Welcome to Z Multimedia Online. Don't forget to follow us on all our socials on TikTok at Z Multimedia, LinkedIn at Z Multimedia, YouTube, ZTV, IDX, and Facebook at ZFMGH. Do enjoy this video.
All right, welcome back to the Business Breakfast on Z101.9 FM with me, Trebi Hammond. Thank you very, very much for staying with us right here on the show. Now, that was Ga Afro Praise Medley by Brian Kufuor featuring Perez Music, and that brings us to exactly 9 minutes after 9. And we get into our roundtable discussion this morning. Now, today we're talking about one thing that, like I said, borders around all of us. You know, for many of us, it's almost routine. You know, when we talk about the issue of malaria, many of us see it as normal. It's a routine. You know, fall sick, take medications, recover, and move on. But what if the real issue is not the treatment, but the prevention? That's exactly what we are talking about this morning. As our environment, our habits, and daily routines continue to actually shape our health, the question is: are we doing enough to stop malaria before it starts? Today we're having a very practical conversation, and our topic is malaria prevention at home, what families, businesses, and communities must do. And we'll be exploring what really works, what we often ignore, and why consistency may be the missing link. And my guest this morning is Dr. Kenneth, Dr. Kenneth Arthur. Yes, I think I got the name. Yes, Dr. Graham. Yes, Dr. Graham Arthur Kenneth. So Kenneth Graham Arthur. Any of them works. He's a medical doctor, and he joins me over the phone lines for this conversation this morning. Doc, good morning.
Yeah, good morning.
Doc, how are you doing?
I'm very fine by God's grace.
Yeah, I'm well too by God's grace. I thank you so much. I can see that you're already at work, but you still made time to be able to join us. I'm really grateful for that.
Yes, you're welcome.
All right, so let's get into the conversation. Now, malaria is so common in Ghana that many people treat it as a normal part of life. From a medical perspective, should it really be considered normal, quote and unquote?
Well, thank you for the opportunity, and good morning to your listeners. Malaria in itself shouldn't be considered normal in 2026 because there have been so many steps that have been taken by various organizations, the Ghana Health Service, and even the World Health Organization to make sure that malaria is So in 2026, it shouldn't be that common, but unfortunately in our part of the world, it's one of the most commonest things that we encounter every day in our setting.
So it shouldn't be considered common because we've done a lot of work towards it.
Yes, we've done a lot of work towards it, and by this time, we should be having fewer cases. Well, if you look at the statistics, the cases are getting fewer, but it is still not good enough. So we are getting there, but we are not there yet.
What are the statistics from where you sit? If you can actually help us with those ones, so that people can see the gravity of the issue.
Okay, so let me date back to almost the beginning of time. I think for 50% of the existence of mankind on this planet, the most lives that have been lost from a disease is because of malaria. Not HIV, not cancer, not anything. It's because of malaria.
50%.
So about 50% of the deaths that have occurred in and from the Stone Age to now have been as a result of malaria. Then from 2022 to now, in the past 4 years, there are different accounts of the incidence and the number of deaths of malaria because some people do not report it. That's one of the problems we have in our system in Ghana. That is documentation and reporting. But from what we have, 2022, we had about 500 to 600 people die of malaria. That is according to the cases that were reported in Ghana. But then if you look at the World Health Organization's statistics, it claims that about 11,000 to 12,000 people died in Ghana during 2022. The number has reduced steadily. From the Ghana Health Service, 2024, 157 people died, and some other sources cite 150 to 250. But in the Ghana Health Service, and the World Health Organization still maintains that even though there has been a decline, the total reported deaths are around 10,000 to 11,000. That's still, so the reason why there's a discrepancy is that, the reporting comes from the major hospitals, the big hospitals in Ghana, whereas the other ones, in the districts, in the rural areas and other places, are not readily reported. So that is what the World Health Organization has factored into all this and is giving us those bigger numbers than what we are typically used to from the Ghana Health Service.
So that means that we seem to be normalizing something that should alarm us, isn't it?
Yes, malaria should not be normalized. And like I said, a lot of work has been done to this time, and we shouldn't still be having it. But gradually, if we continue in the same vein, we should eradicate malaria in the near future. So we are on it.
But what do you think we are getting wrong in the way we think about it?
So one of the main things that we can attribute to malaria and we not progressing the way we want to progress, it's one, the education. We have done a lot of education, but it is not enough. The prevention. Malaria can now be prevented. We have little things that go from what you and I can do just by being at our homes to what we can do by coming into the community and what we can do also at our workplaces. But the thing is, many people do not know. That's one. Those who also know are not practicing it. And lack of education too. Even now, since 2021, there has been a malaria vaccine. Just like we have vaccines for other childhood diseases like measles and rubella and all those things. We have malaria vaccines. But how many of us know that there are malaria vaccines to even go for them for our children? So I think education is one of the main things that has not really been done to the extent to which we can do it. I mean, it is ongoing. We are trying. The government is trying. When you come to the hospitals, we try to educate people before they leave and go home once they are well. But generally, on our internet spaces, social media, radio stations, news stations, the education is not really done. What I've observed is that we have a World Malaria Day, and on that day we talk about malaria a lot, and after that, that is it. So more can be done.
So do you think it's also as a result of how other illnesses, of course we don't have to choose in between them, but I think that is where we find ourselves, where attention is given to issues or health conditions that we think are more dangerous, compared to malaria. Because people recover from malaria easily after falling sick and all of that. And so we think that is that. Do you think that is why we think it is normal?
Well, it could also play a role. So the thing is, malaria is endemic in this part of our world, the tropical parts of our world, because it's very rare for you. For instance, let's say back when I was in medical school, we used to have students from Germany, USA, Croatia come to be with us for an exchange program. And when they hear that there is a case of malaria on the ward, they are also interested to go and see it because they rarely see those cases at their end. You understand?
Yeah.
It is a rare thing for them. It's a rare phenomenon to them. So for them, they are even they that are not having it in abundance, they are trying everything they can do to eradicate it and prevent it from coming to their end. And the little ones that come to their end, they are trying to solve it as soon as possible. But for us, we see it every day. We see it everywhere. Every point in time, there is someone with malaria. So you have normalized it. And that's not how it's supposed to be, honestly. We have a long way to go. And I think, like I said earlier, education can be part of it. And yes, I get you. The onset of some new diseases and all that might have taken the conversation away from malaria. But then again, balance is the key here.
Right.
We can do the education. We have dedicated malaria um, workshops and all those things that are supposed to educate the public on time, investments, and all that are made for these companies and these workshops. They can send their message across and reach.
All right. Doc, unfortunately, the line is breaking. I'm not too sure what the cost might be, but maybe you can go off video for us so that I'm sure when you do that, we'll still be able to hear you here. But can you hear me? Hello, Doc? Hello?
Yeah, hello.
Yes. So I'm saying that the network seems to be lagging a bit. So if you can go off video for us, I'm sure that should help us. Yeah, we can.
Okay.
Yeah, we can still get to hear you anyway. All right. So let's continue the conversation. So, what do you think are some of the biggest misconceptions that people have about malaria? I mean, about how it is even spread.
Oh, okay. Okay. So, one of the things I'll say about malaria, one of the biggest misconceptions is, whenever in our setting, whenever someone has a headache and a fever with some general body pains, there is this assumption that the person has malaria, and the person just goes to the pharmacy, just goes to buy some medications, or just goes to tell the pharmacist that I have malaria, and then they give the person Lonart, Coartem, Lufat, all those malaria medications. But then again, those symptoms that you present with are classical symptoms for a lot of diseases. A lot of diseases. Per our guidelines now, initially we used to do a rapid diagnostic test and then people treat malaria. But then now we have to do evidence-based medicine where we have to do the gold standard investigation, which is a blood film for malaria parasites before we treat malaria. So the conception that whenever you feel weak and lethargic with some headache and fever, you have malaria, that is false. Then again, malaria, even though we underestimate it because it is common in our setting, sometimes can be a very difficult case to treat because we have so many complications of malaria. And the worst of them all is what we call cerebral malaria, which is when the malaria parasites are able to cross the blood-brain barrier and then they go to the brain and they start affecting the brain. And those ones, the mortality is very high, about 20%. So people thinking malaria is something that can be easily solved by over-the-counter medication and all that. I think it's not helping the cause because then again, they come to us in severe states, and then even though the treatment, we have the medications to treat them, it is better for you to come to the hospital as and when you feel these symptoms.
Right.
Because these symptoms could also be typhoid fever. It could also be a gastrointestinal infection. Then again, you do not know and you're treated for malaria. And that is where the problem is. So the self-medication is one of the biggest problems that we have when people think they have the symptoms of malaria.
Now, many people actually believe that malaria just quote and unquote just comes. Can you walk us through the process of how, what actually has to happen for someone to get infected?
Okay. So I'm sure most of us know this, that malaria is caused by the female Anopheles mosquito. So the mosquitoes, we have the male, we have the female. The male actually does not need human blood. It actually feeds on nectar, like most other insects, nectar from the flower. But for the females, they require a protein meal for their unborn babies. So what they are doing is to survive. So when they are feeding on a human, they are taking what we call a blood meal. That blood meal is to support their, in quotes, pregnancy for their um, unborn mosquito. So when they bite you, so it's only the female mosquitoes, Anopheles mosquitoes, that bite. And then when they are taking their meal, in as much as they are taking blood from you for their meal, they are also introducing the bacteria, the parasite that causes malaria, which is Plasmodium.
Okay.
And the one that causes the malaria that we typically know of is called Plasmodium falciparum. So we have other species of Plasmodium, but we will not focus on them now because in our endemic area in Ghana here, the one that typically causes malaria is Plasmodium falciparum. So once that mosquito is taking that blood meal, they are exchanging. So they are taking your blood and they are introducing this parasite into your bloodstream. And then that is the start of the whole cycle. So once they are introduced into your bloodstream, they take some time. So from 7 to 30 days, these Plasmodium parasites move into your blood cells to your liver, where they develop, and then they develop. So they have stages in their development, from merozoite stages to trophozoite to scadunt and all those things. But then, just to make it simple, once the female Anopheles mosquito bites you, they exchange. So they are taking your blood for a protein diet for their unborn baby, and they are giving you the malaria parasites. The malaria parasite comes into your bloodstream and moves into your liver, where it develops and matures. Then it creates your red blood cells. And once it goes into your red blood cells, it bursts and releases into your system. And that is where the whole fever, chills, and everything starts occurring. Because once it goes into your system, your body's immune system tries to arrest it. And that immune regulation or the immune reaction is what makes us feel all those things that we feel. Then again, when they go into your blood cells and then the red blood cells and then they burst the red blood cells, it can lead to a couple of things which can lead to complications of malaria from what we call hemolysis. So some people, they realize that when they have malaria, their urine is like Coca-Cola color.
Color, right.
Yeah, so that is basically your red blood cells that are hemolyzed or broken down by these malaria parasites. And then they are coming out of your system through the urine. Other times too, you can have jaundice. Other times too, you can have low blood sugar. And other times, these malaria parasites can move, like I said, through the blood-brain barrier to your brain, and then they can cause way worse effects. So it's basically that, but so it can lead to a lot of complications from just them coming into your bloodstream. For the parasites, it needs a host to survive. Unfortunately, we are that host. So the parasite feels like it's living its normal life cycle, but to the detriment of we, the host, the humans. So that's basically how the whole thing starts, from the female Anopheles mosquito to it being a well-blown flu disease.
I see. But so why do we keep seeing repeated malaria cases in, say, the same household? What exactly is happening there that is making malaria, spread in that particular household? Because I see that a lot.
Okay. So malaria spreads through a lot of things. One, the commonest ones that we normally know or see is stagnant water. So we have clean stagnant water and dirty stagnant water. Basically, the stagnant water is a provision of a well resource area for the mosquito to be able to lay its eggs. Yes. And once the mosquito lays its eggs, there are going to be a lot more mosquitoes in the system.
Right.
A lot more mosquitoes in the system, especially the females who will need a blood meal for their unborn babies. And these these mosquitoes, their life cycle is not like humans, that is years. For some of them, it's just weeks to months. So they are living their whole life cycle in weeks to months, meaning that once they are born, in a few weeks, they are going to grow up, get pregnant, and then they are going to need a blood meal. So the more we have these stagnant waters there, the more they are going to lay their eggs there, the more they are going to hatch these eggs, become full-blown adult mosquitoes. The females will require the blood meal from a male, or from a man or a human, to be able to carry out their pregnancy, and that is going to lead to the spread of malaria over and over and over again. So the first is our environment. That is the first one.
Right.
The second one is that sometimes patients do not have full treatment. Like I said, most people just go to the over-the-counter places and then they get medications in the name of solving whatever symptoms that they have as malaria. And they take the medications once, twice, and they feel okay. And then they stop. They don't complete the full treatment. Then again, if you are not completing the full treatment, you have not eliminated all the parasites in your blood. These parasites will then come back stronger and attack you. And then you will now be rushed to the hospital because of all the complications of malaria. So basically, it's a result of their breeding areas being predominant in our areas that allows for reinfestation, because we have the person that's come to hospital, we have helped manage the case and the person is fine now. But then the source of the parasite breeding ground, the breeding grounds for these mosquitoes and the parasites are still there. Once the source has not been eliminated, the disease cannot be eliminated completely from the environment.
I see. Now, why do you think many people actually focus on the treatment instead of the prevention? What could be the problem?
I feel like I said earlier on the call, one, lack of knowledge on how to prevent these things, and two, the efforts to implement the prevention of these things. The efforts include getting rid of all stagnant waters. The efforts include avoiding littering unnecessarily. The efforts include desilting gutters, so that those, usually fields are left in gutters by the roadside and all these things. When it rains, they are carried into our gutters and they even block some of these passageways for the water, creating stagnant water. This stagnant water now becomes a breeding ground for mosquitoes, which will eventually lay their eggs. They will grow, come and bite humans, and then give humans malaria. It is our job to, one, not litter. It's our job to not leave ties. When you leave ties there, when the water collects in the ties, that's a nice breeding ground for these mosquitoes. Then again, the gutters that are blocked, stagnant water is there, nice breeding grounds for them. Also, when people that like to leave their containers or their basins outside to collect water, maybe during rain or something, and they don't cover it after the water has been collected. The water is there for 2 days, 3 days. That is all the mosquito needs to be able to lay its eggs and hatch its eggs. So there are simple things that we can do. But because it involves some effort, for instance, taking a day off to actually do some communal labor, to desilt gutters, to enter gutters, to do things, people are not willing to do those things. But then again, it is these simple practices that are going to help us to be able to eradicate malaria if we are really serious about it.
So I think we underestimate the preventive measures.
True.
But what are the long-term risks of relying on treatment instead of prevention?
So the long-term risk of relying on treatment and prevention is the fact that the malaria, the breeding grounds for the mosquitoes will still be perpetually seen in our environment, which means that we are solving the problem, but we are not eradicating the problem.
The root cause is still there.
The root cause is still there. Hence, the problem will still be there. That is the major issue now, because malaria is never going to disappear from our environments if we are not targeting it from the grassroots, from the stagnant waters, from the uncovered containers or basins, from the filth we just throw onto the roadside instead of putting them in proper dustbins, from the car tires and any other thing that can house water and make it stagnant. The denominating factor in all this thing is water. So any stagnant water that is there that we are not eradicating, that is going to be a problem for us. Then again, too, there are simple things that we can do from our households. For instance, sleeping in treated mosquito nets. That is one. We can also do inside residual spraying with mosquito insecticides. We can also um, wear long sleeve clothes to be able to prevent the mosquitoes from biting us. In addition to that, we can also use mosquito repellents on our skins. Usually, these mosquitoes usually like to have their meal between the hours of 10 a.m. to 2 a.m. So within these areas, we should be able to protect ourselves. Also, in pregnancy, pregnancy is one of the ways that a mother who suffers from malaria can give the child malaria. So the child is born with malaria, and it can lead to so many things, low birth weight, and all those other complications of it. So there's also a treatment for women in pregnancy who to just prevent them from getting the malaria. We have something called sulfadoxine pyrimethamine, which we give to them from their second trimester. So basically, what I mean is that the pregnancy is 9 months. It's divided into three trimesters. So the first 3 months, second 3 months, last 3 months. So the second 3 months, that's 4 months to 6 months, we can start giving them intermittent preventive malaria treatment. Also, like I said, we have vaccines that are rolling out that we can do. So all these things can prevent someone from getting the malaria. But then again, the most important of all these things is to get rid of the stagnant waters in our communities. Because once we get rid of these stagnant waters, the mosquitoes will not even be around as much to be able to cause the transmission to get the malaria.
All right, Doc, hold on for me. Let me just announce the phone lines in case anybody wants to ask any questions or make certain comments there so that they are able to do that. All right, so, well, if you just tune in, this is Business Breakfast on Z101.9 FM with me, Trebi Hammond. This morning, we're talking about malaria. Now, tomorrow is World Malaria Day, and that is why we're having this conversation today. My guest is Dr. Graham Arthur Kenneth, and he is a medical doctor, and he joined me for this conversation. You are free to also join. Feel free to send me a WhatsApp on 0544321019, 0544321019, or you can also call me on 03039566641, 03039566641, and then we give you the opportunity to ask your questions or make your comments this morning. We're streaming live on Facebook at ZFMGH and on YouTube at Z Multimedia. Please feel free to drop a comment under the live stream and we'll read them for you as well. Yes, and also feel free to share the link with your family and friends and get them to be a part of the conversation this morning. All right, Doc, let me come back to you now. Now, I know we touched a bit on some of the issues in regards to prevention. We've talked about some misconceptions, but I want to take you back to some of the misconceptions. Are there some beliefs or practices that actually delay proper prevention or treatment?
Well, so they are not really concrete beliefs per se. But then the common thing is because malaria usually fever, chills, rigor, most people just, and this is usually in the rural areas, most people resort to some form of herbal medication because they assume to bring down the fever.
Yeah.
It's good. The fever will be brought down, but then again, the problem is malaria. So once you bring down the fever, you have not done anything to the malaria parasites, which are actually causing the fever in the bloodstream. So hence the fever might occur. What we see in health facilities is that this patient or this person has been having these symptoms for a long time, sometimes even as long as a week. And then they bring this patient, and the patient is very, very in a bad state than if they brought the patient a day or two at most since the symptoms started. So, not to attack herbal medication per se, but I think the lack of thorough investigation, people thinking they can just treat it at home, is one of the main things that leads to worsening outcomes. Because once you are in the hospital early, malaria can be treated and will not lead to any complications. But if they in the reliance on some home care medications, including herbal medications, that sometimes worsens the malaria patients.
Right. Very helpful. Now, back to the issue about the prevention. You talked about the fact that many people actually know what to do, but they don't do it. How do you think we can move people from knowing what to do to actually doing those things? What can we do?
So one, we can make things easier for them.
How so?
I think somewhere 2008 to 2010, when we started this malaria campaign and it was in full force, we were distributing mosquito nets free of charge. And there were people who were actually moving from town to town, from place to place, making these announcements, distributing these things. And I think that activity has died down over the years. We can bring back some of those activities. We can revive them. We can also increase the publicity of some of these things. So if I want to share free insecticides, if I want to share, that's from the government's point of view. If I want to share free insecticides, if I want to share treated mosquito nets, if I want to offer mosquito repellents and all those things, there should be a lot of publicity on these things. Some of the publicity on these things are very, very poor, or they are even non-existent. So for the people to know, and for this current generation where they are more on their phones than behind television sets and all those things, I think we should also increase the efforts there. Then again, previously there was this practice where every week there was one weekend in a month where they do communal labor and all that, and it was sort of compulsory. Now it's not really seen in the environment as much as it was. Our gutters are still there, choked, and the containers that maybe have been moved from place to place because of heavy rainfall are still collecting stagnant water. And if we are able to do all these communal work, we are able to do this publicity to be able to distribute some of these insecticides, treated mosquito nets, and the repellents that are going to help prevent one person from getting malaria. I think this is going to go a long way in reducing the numbers of cases and then the mortalities that we see in our facilities.
Right. Now let's focus on the roles of community business leaders and business institutions and all of that. First of all, how important is community action in the prevention process?
I think it's very, very, very important. I think it's probably the most important because, in as much as we can take care of ourselves individually, malaria, like I've said, malaria occurs mostly in the community, in the environment, with regards to stagnant water, with regards to the amount of filth in the environment, which would eventually lead to stagnation of water and all those things. So community involvement in prevention is paramount, is very, very necessary, it's key. It's one of the most important ways that we can reduce because most of these things we are discussing that can help prevent or eradicate malaria in our communities, they need people to come on board. They need a group of people. One person cannot do it on their own.
Right.
One person cannot distill all the gutters in the community. One person cannot say, I'm going to stop littering, and then all of a sudden everybody stops littering. No, it is a community that has to decide that we are going to uplift the status of this community by indulging in safe healthcare practices. Not littering, not leaving to collect stagnant water, and like doing communal labor to eradicate these stagnant waters if they are already in the community. So communal work in terms of prevention is, I think, one of the most important, if not the most important thing that we can do to eradicate it. And it has to do with oneness of the people in the community.
Right.
You ask about business involvement and all those things. Those things can be done. And I currently, this week in particular, I think on a Monday, I went to one of my facilities that I am at, and the health workers themselves, including some of the hospital staff, were silting gutters.
Wow.
They were the silting gutters because we are in the fourth month of the year. This is the highest amount of malaria cases that they have seen in the past 5 years. So they have embarked on a community outreach to desilt gutters. And I think because the World Malaria Day falls within this week, so they're also using it as a source of education to the
Right.
public on what they are doing, why they are doing it, and the importance of what they are doing. So this is where the business can come in, because the hospital itself is a business, and the hospital leaders are the ones who have decided that they should do this, and they are setting an example.
Yeah.
Hence, the community people will also join in. So this is how we can liaise to do things together. I mean, we can do things on the manual skill, like what I just described, or we can do it on other skills. There can be education, which will involve financial assets and all that. And it's going to go a long way. Like I said, some people do not know. Others also know, but they are not doing it. So once you're able to make some of these things, for instance, we are doing a community cleanup this Saturday, and then after that, there will be distribution of, say, the Ghanaian people, there will be distribution of, say, some breakfast or something afterwards.
Yeah.
That is a way. That's the way you can encourage people to do it.
Be on board. Yeah.
Even though they might be coming for the breakfast, but the job gets done. The education gets out there. They would hear something before they go back home, and that is something I'm stay with them for a long time. So, like I said, all people can come on board to help with this, but the community is one of the most important and the strongest tools we have in preventing malaria and eradicating it completely.
Right, very important. I was going to ask you some of the practical things that they can do, but I think you've mentioned some of them already. Let's turn to the businesses. I know that beyond households, businesses should also be able to play certain roles. What role do you think they should play? And by that, I'm even talking about businesses. We can also look at schools and even workplaces. What can they do in preventing malaria?
So the first thing, that's one of the things that keep on repeating. I keep on repeating in this conversation is education. You mentioned schools. That's one of the best places to do education, and that is where you can even catch them young. You have young children who we can speak to, who we can educate on malaria, and these people will go to their homes and tell their parents what they learned. And so instead of you teaching just one child at home, you are teaching a family, because that child will go and talk to their family.
Right.
And they can now incorporate something. So I think instead of just waiting for World Malaria Day is good, but instead of us waiting for one day in a year to propagate this message, we can do a monthly, a bi-monthly, or a quarterly malaria education program in our schools. For the businesses too, we can do a communal day where you don't need to be a health facility to be able to help with malaria prevention. You can be a bank, you can be a law firm, you can be a media station and all those things. And you can just put maybe 1 week aside every half a year, every quarter, where we can do some communal labor, desilting of gutters, weeding away some of the weeds that might also serve as a place for stagnant waters and all that. Then again, too, we can also hammer on the education from other places of view. For instance, media houses that have a strong presence and can do the education. When you look on media channels and all those things, you realize that health education is very minimal, and it's mostly entertainment that you see on these channels.
Yeah.
So if we can focus on malaria and other things that are affecting their health, because a healthy country is a wealthy country. Hence, we can't be having people die of things that are very, very avoidable. There are some conditions that are very preventable, very avoidable, like malaria. And I think these are some of the things that we can do to make sure that we keep most of our people healthy and free from malaria.
I see. Right. So companies, businesses, schools, workplaces, all of, all have some roles to play in there. Do you think there are certain things that maybe a workplace can integrate into their culture to be able to prevent the to be able to prevent malaria?
Okay, so let's take the workplaces for now. So the first thing is, we know, even with this, I think this government made a promise of 24-hour economy, which means that people will be working at night,
Yeah.
which falls within the peak hours where these female anopheles mosquitoes bite you and can spread the malaria parasite through you. So what the workplaces can do is provision of these things that prevent malaria.
Mm.
For instance, mosquito nets for people who are likely to stay in workplace facilities. For we can also provide insecticides for spraying these places to prevent our workers from getting malaria. We can also give them these repellents to do that. So that is one that we can do. We can also encourage protective clothing during these peak hours so that those who are working nights and all wearing shorts attires and all those things to be getting the malaria. So charity begins at home. So the individual can do something about it. The workplace can also do something about it. Then again, sanitation, like I said, this is not limited to just healthcare workers.
Yeah.
It can be done by every company at all, where you can once in a while engage in some cleaning or maintenance of your places, be it bushes, stagnant waters, and all those things. A clean environment means that there is no where for these malaria parasites or these mosquitoes to be able to breed and then get more of them to give us malaria parasites. Then again, to these companies can institute health policies. You know, for instance, um, one of the in-service trainings, there can be a health talk.
Yeah.
For now, because we are talking about malaria, there can be a health talk on malaria, and then there can be testing for workers. There's a rapid diagnostic test, though it is not the gold standard now. It is very, very important key in determining whether someone might be having a malaria, might be having the malaria or not. So routine health education on malaria prevention, early testing can also help in at our workplaces to be able to prevent malaria. Then again, to have the community, we have already spoken about it, education. We can also do the distribution of the mosquito nets, the repellents, and then the insecticides. And we can also be doing the monthly or even weekly cleaning campaigns to be able to make sure that the community is good and then it's clean to prevent the breeding places of malaria of mosquitoes from being readily available to them. So we all have a role to play. And then for the health systems too. Then again, if the person eventually gets the disease and then comes to us, we can, in treating or managing the patient, we can also do proper education and give preventive therapy like in pregnancy, like I said. And we can also do surveillance and reporting so that we know that, oh, okay, maybe this particular environment or town or area that we are in, these are the number of malaria cases that they have been getting over the past few years. It's going up, it's going down, or it is still at the same level. And that will help us know how aggressive we should tackle it.
Yeah.
And then last but not least, like I said, malaria prevention begins with the individual. So these simple things, sleeping in a mosquito net, repellent, wearing long dresses or long clothes to cover your body during the peak hours, the indoor residual spraying, and seeking early treatment, not self-medication, seeking early treatment, and avoid medication without testing. This will go a long way to be able to help us all to be able to prevent malaria from, like, starting with individually to our community, to our schools, and also workplaces.
All right. Okay, Doc, my last question to you. We often focus on the health side, I just want people to understand the gravity of it, especially when it comes to the economic impact that malaria has on families and on businesses. What do you have to say to anybody listening to us in that regard?
Okay. So, whenever someone has malaria and comes to the hospital, or whenever someone has any disease and comes to the hospital, there is going to be significant financial burden
Yeah.
from laboratory testing to sometimes imaging investigation, though they might not be necessary in malaria, depending on the complications the patient comes. Also to medications, to hospital stay, and all that. This is money that you could have saved for something if you had just applied the knowledge that you have been given. If you just were able to do this preventive stuff. So I think the finances and everything, we do have an insurance, but you are still going to feel the effect financially. Then again, nationally, when more people are sick with malaria, less people are going to work, which means that the economy is not going to be as vibrant as the economy is not going to be as vibrant as it's supposed to be, because less people are going to go to work and contribute to the financial aspects of the the country or the economy. So then again, like I said, the finances are very staggering, especially if you are in a private facility or a private facility the closest to you. And then it's going to also affect us because less people go to work. And then if you are coming in with any of the complications, like I said, we have malaria, simple malaria, which is when someone has this headache, fever, chills, rigors, nausea, vomiting, abdominal pain, diarrhea. That is fine. Fatigue and malaise. Typical uncomplicated malaria. Then again, we have people that come to us with malaria and they have impaired consciousness, or even some of them come in a comatose state. They are in a coma. Others also come in prostration. That is like trying to bend themselves in positions that will relieve the pain, or in weakness. They cannot stand. They cannot sit. Some also come with multiple convulsions or seizures. Because of malaria, some people can be having seizures. Some also come with respiratory distress. Some also come with pulmonary edema. Some even come bleeding from their ears, their nose, their eyes. Some come very severely anemic. All sorts of things. Even malaria can cause an acute kidney injury. It can affect your kidneys, it can affect your liver. It's targeting like vital organs. And these are people that are coming in severe malaria, not the uncomplicated malaria I talked about earlier. And then if it crosses the blood-brain barrier to your brain, you are going to get cerebral malaria, where your mortality rate is going to be increased. So, like I said, malaria, not just, it's not just what we see, the normal chills. Sometimes it develops into worse conditions. And the worse it gets, the more finance you are going to, or financial or loss you are going to incur. Because you are going to do more tests, you are going to buy more medications, you are going to stay in the hospital longer. So why not just prevent it instead of getting to that level where it will affect you? And then if unfortunately the person dies, you have lost one of the manpower that is going to help the economy in this country. So prevention is very, very important to prevent all these things from occurring.
Right. Doc, thank you very much for your time. I'm really grateful that you joined us this morning, sharing your thoughts on this particular important subject matter. Thank you very much.
You're welcome.
Okay, please do enjoy the rest of your day. Hopefully we can speak again another time.
Thank you. Looking forward to that.
Okay, sure. All right, so that was Dr. Graham Arthur Kenneth. He is a medical doctor, and he joined us this morning. We've been talking about malaria. It's one of the things that people think is not very serious. So once you get malaria, you can go get your drugs and then you are done. But we are learning today that the numbers are staggering, very huge. Cases of malaria recorded even in this first period of this year, just this first 4 months of the year, or this first quarter of the year. what we are seeing are quite alarming, and that is why we must all get involved in prevention instead of just treatment. And so wherever you find yourself, let's take care of our environments. Let's make sure that whatever we are doing doesn't promote people, or doesn't promote a risk, of malaria towards us and even people that are connected to us. And so it's very important that we all play our role. So sleep undertreated, mosquito nets, the basic things that we all know, let's actually move them to action. Knowledge is not enough. Let's move them to action. So that's how we wrap up today on the Business Breakfast on Z101.9 FM. If you missed any part of the conversation, you feel like you want to go play it back, it will be on our social media platforms, on Facebook at ZFMGH and on YouTube at Z Multimedia. Feel free to visit and play back. But that's how we wrap up. We're back again.
Thank you for watching. Don't forget to like, comment, and share. And also do follow us on all our socials. On TikTok at Z Multimedia, LinkedIn at Z Multimedia, YouTube at ZTV, IDX, and Facebook at ZFMGH.